Okay, it is 9 a.m. for you all, 10 a.m. for me, so I will go ahead and get started. Good morning, everyone. My name is Lindsay Wyatt. I am the Associate Director for our 2023 Culture of Data Conference. I'm really excited for y'all to be here today for our second third of the conference. I am also a part of the Emerging Leaders Committee, and I serve as the Community Engagement Delegate. So I will be the session's moderator today with support with my colleague, Angela, who is also on the Emerging Leaders Committee. We have Rachel Mossman, who's managing the Zoom and making sure that our tech is running smoothly. And if at any time you have a question, please go ahead and put it in the chat. That is enabled today, unlike our keynote speaker yesterday. So we did fix that problem. So if at any time, go ahead, put something in the chat, or feel free to raise your hand or unmute yourself, and we will have a Q&A portion after our presentations. So before we get started with our presentations, I do want to thank our sponsors who sponsored the session. We have the Colorado School of Public Health, JSI, and Moxley Public Health, so I want to thank them formally. And so I will cycle through each sponsor and give them a few minutes to speak. I will start with Danny Britton for the Colorado School of Public Health. Go ahead and say a few words when you're ready.
Thank you so much. Thank you for being here. I want to share my screen really quick, just to provide some acknowledgements of some of the work that folks have been doing. But thank you so much for having me here today. As was stated, my name is Danny Britton. I'm Associate Dean for Academic and Student Affairs in the School of Public Health, and just so happy to be here and collaborating again with CPH on a wonderful National Public Health Week 2023. Last fall, Colorado School of Public Health became CPHA's first organizational member, and that partnership really gives all of our students and staff the opportunity to access the state professional group in public health because we provide those memberships together. So it's been really great. And of course, over the past 10 years, we've been a presenting sponsor for Public Health in the Rockies. And then, of course, today, this wonderful event with Emerging Leaders Showcase. So what I have on the screen here is an important second annual Rise Magazine publication that has come out. And what's important about this is that it's not only just a wonderful display of people in public health, our students, our alum who've been doing wonderful things impacting Colorado public health, but it's also an experience for our students to get involved and engage in leadership and development of what it means to have the Rise magazine. So I just want to acknowledge some aspects of Rise magazine right now. So our Colorado School of Public Health students and alumni who are involved or featured in the Rise magazine, here are the ones that are featured. So we have some amazing folks who I know all of these names and all of the contributions that they've been giving. So please go to Rise magazine and check it out. And then here's all our students who've been involved. And I really want to give a special shout out to Samantha Bertman and Jenny Mitchell, as they were director and associate director of Emerging Leaders. But no one deserves more than just this entire list from our School of Public Health. But all these people, alumni and students, have been so involved, and we thank you for that. Now, in terms of just moving forward, us as a School of Public Health, we just value this collaboration with CPH so much. And there's never a year when I go by thinking, oh gosh, how can CPHA and School of Public Health do more? But I know we can. But we do so many great things together. And another quick shout out, I want to give Tanya Ewers, our Director of Marketing and Communication, and Catherine Brumfield, our Career Services Manager, just an acknowledgement that they work with CPHA every month. But we're so proud, again, of a relationship with CPHA and the School of Public Health, and our impact together is so far-reaching. So I'll stop there, but say Happy National Public Health Week to all of you again. Thank you.
Awesome. Thank you so much, Danny. I am a CSPH alum as well, so I'm always happy to have y'all's presence here. The next sponsor and who we have that will speak for us is Lakisa Fashone for JSI. Go ahead, Lakisa.
Hi, thank you so much. I'm representing JSI and we are proud sponsors of this event. JSI is a research and training institute founded in 1978. We are a 501c3 nonprofit public health and healthcare research and consulting organization. We're dedicated to improving health equity for better health outcomes around the globe. And for over 40 years, JSI has applied practical, technically sound, and innovative solutions to challenges facing public and private clients, including federal. That includes HRSA, primary healthcare, HIV/AIDS Bureau, CDC, and some other organizations, and county agencies, as well as legislatures, community health centers, rural and school-based health centers, hospitals, and community-based organizations. We work in all types of settings, urban, suburban, rural, across all 50 states and 7 territories. And I don't know if I can share my screen. I'm kind of working on dual screens. One second. Okay. Are you able to see this?
Yes.
Okay, so we have the following core values: integrity, equity in action, adaptability, connectedness and collaboration. And we've been working on a regional family planning project and supporting that. And that's one of our biggest projects. And we have the following clients: community health centers, foundations, membership associations, and work on climate and environmental health, family health policy, health systems transformation, and a variety of other topics. But we are so happy to be sponsoring this event. And yeah, thank you so much.
Thank you, Lakisa. We appreciate it. And then finally, I will give it to our last sponsor, Stephanie Moxley, who represents Moxley Public Health.
Sounds good. Lakisa, first of all, thank you. I was excited that you were presenting. I used to work at the JSI Boston office and then the JSI Denver office. So it's fun to hear from JSI. So I'm Stephanie Moxley, founder and CEO of Moxley Public Health. We are really excited to be proud to be sponsors of the Culture of Data conference this year, because we love data and it is how we do our work and serve our clients, but also because Colorado is extremely special to me. All of my 4 daughters were born in Colorado, and I lived there for over 12 years. And many of my best friends live there, so I still spend a lot of time in Colorado. I'm now based in Ohio, but we serve clients all over the United States and even all over the world. At Moxley Public Health, we do one thing, and we do it really well: community health needs assessments and their accompanying improvement plans. We help clients that are primarily health departments and hospitals conduct and complete the community health needs assessment process. We do this by offering 2 services: our traditional full service consulting, where we come along our clients and do all the heavy lifting and basically lead the journey of the community health assessment and improvement plan process. So we collect all the data, analyze that data, facilitate the process of making decisions with that data on selecting priority health needs, and then selecting strategies to address those health needs. And of Of course, we write the community health needs assessment and improvement plan reports. We also offer a service we call the CHA and CHIP Toolbox Package, where we serve clients who still need to complete the community health assessment process, but for several reasons are not hiring a full service consultant. So we give the client absolutely everything we have, spent a bunch of time developing to complete the community health assessment process that includes interview guides and example surveys, how we identify health disparities for each health need, presentation templates. We've created a resource guide full of evidence-based interventions by health need, and of course, our beautiful and eye-catching report templates. At Moxley Public Health, we put a big emphasis on identifying health disparities with the data that we collect along each step of the community health assessment process, collaboration with community partners, and data visualization and communication so that the data is approachable, digestible, and most importantly, usable. Along with our consulting services, we always have a lot going on over here at Moxley Public Health. We currently have an internship program called Women Supporting Women in Public Health. And we just started a needs assessment project with a community in Jamaica that is near and dear to my heart. So if you want to learn more about our community health assessment services, or just want to hear more about all the magic and cool things that are happening over at our company, head over to www.moxleypublichealth.com to learn more and reach out to us.
Perfect. Thank you, Stephanie. Thank you to all of our sponsors for the work that they do and for sponsoring our emerging leaders in the field of public health. I'm going to hand it over to my colleague, Angela Ohm, so that she can introduce our first presentation.
Thank you, Lindsay. So like Lindsay said, I'm Angela Ohm. I'm one of the Culture of Data delegate in the CPHA committee. The theme of this session is the Emerging Leaders Showcase. I'm excited today to welcome you to this showcase that has been a collaboration with the CPHA Culture of Data Committee and the Emerging Leaders Committee. We were inspired to create this platform specifically for emerging leaders to ensure that they had a place to present their incredible work. We believe that in order to create a public health movement and the next generation of public health leaders, growth and development, it should be highlighted and continuously supported. We are so excited that these efforts have led to create the Emerging Leaders Showcase. We hope you enjoy today's session, and we appreciate your support of our Emerging Leaders presentations. Thank you. Our first presentation is titled, Who Bears the Cost? Collaborative Efforts to Enhance Environmental and Data Justice for North Denver and Commerce City Communities. And it will be presented by Ruth McConnon and Carla Nyquist.
Good morning, and thank you all for joining us for our session today. My name is Ruth McConnon, and I will be presenting, as Angela mentioned, with my coworker, Carla Nyquist. So again, welcome to our presentation, Who Bears the Cost? Collaborative Efforts to Enhance Environmental and Data Justice for North Denver and Commerce City Communities. We are presenters from the Dickinson Lab at the Colorado School of Public Health. I'm personally an undergraduate student at CU Denver, as well as a GIS analyst and research assistant in the lab.
And my name is Carla Nyquist. I am a recent MPH graduate from Colorado School of Public Health and a current professional research assistant in the Environmental and Occupational Health Department.
And a little bit about the Dickinson Lab. We're a team of researchers that work across disciplines and communities to advance environmental and climate justice.
And we're here today to share with you a story about the power of collaboration, community research partnerships, and data justice.
So before we begin our story, we first wanted to talk about data justice. Data justice is an approach that looks at all the ways that information is collected and disseminated and aims to counter oppressive data practices that have largely harmed BIPOC communities and systemically erased other forms of knowledge, such as lived experience. Environmental health data often is disjointed, siloed, missing, or considered proprietary and not publicly available. For instance, as our team began to research rail traffic in North Denver, we quickly found that major data access barriers did exist. And while neighborhood level passenger data was readily available through CDOT, RTD, and Amtrak, freight rail information was only available in aggregate at the state and regional level. Therefore, some of our discoveries relied on conversations with experts and eyewitness reports from North Denver residents. What we don't know can hurt us, and this has become more apparent with the train derailment in East Palestine, Ohio. Because small-scale freight data is inaccessible, individuals and communities who reside near rail facilities do not have access to information about what types of freight are carried through their neighborhoods, or even how much freight trains pass through during an average year. Therefore, it was important that our research identified knowledge gaps and data limitations, which became the data audit component of our report that you'll see soon, and utilized powerful data visualization tools to share our findings with historically marginalized communities, policymakers, and further our environmental justice or EJ goals.
So data justice is a key component of an evolving environmental justice framework conceptualized by our collaborators at Northeastern University in Boston, deemed relational environmental justice, which inspired our collaboration, the Reciprocity Project. The goal was to shift the EJ narrative from a traditional kind of quote unquote damage-centric focus that can unintentionally perpetuate a single and often harmful story of EJ communities to a hopefully more nuanced understanding of how all communities play a role in the environmental justice story and have a responsibility to support systemic change. In collaboration with Boston-based EJ group Green Roots, the Northeastern team developed an EJ communication tool deemed a reciprocity quiz to educate residents of more affluent communities in the Boston area about how they rely on the services provided by a high environmental risk community in the area, Chelsea Creek, and therefore have a responsibility to support Chelsea Creek residents in their efforts to reduce the environmental harms in their neighborhoods. The current situation in North Denver parallels that of Chelsea, where residents of less impacted communities benefit from services and industrial facilities concentrated in EJ communities. But as we began our North Denver work with our community partner, GreenLatinos, it became clear that developing an educational tool targeted for low environmental risk community members was not their first priority at the time. We were then reminded of an important tenet of community engaged work to ensure that it is always responsive to the priorities of the community, even if this deviates from the initial plans. Local context is also key in EJ work, as every community is different and their needs are different. Thus, the North Denver EJ report and data audit was born.
So the North Denver report, which can be found by scanning the QR code in this slide, sheds light on the reality that in varying ways and to different degrees, we all benefit from goods and services that cause environmental pollution. And we all bear some of the burdens of that pollution as well. Our research focuses on cumulative impacts of multiple interconnected slides listed at the bottom of this slide on residents living in the relatively small geographic area that is known as North Denver, consisting of Commerce City, Globeville, and the Illyria-Swansea neighborhood. We have also included appendices of relevant data and explanations of policies and bureaucratic jargon that often creates barriers to understanding laws governing environmental protections, such as the Clean Water Act. Despite the need for better data, our findings were clear. The presence of industry is exposing residents to a compounding and cumulative set of burdens, while the benefits of these sectors largely flow to communities in surrounding areas. We must take action to address the clear and documented sources of exposure, that North Denver communities face. In response to priorities set by the North Denver residents, GreenLatinos, and Ian Tafoya, we disseminated our findings to the community, participated in political processes that could bring about broad-based change, and celebrated our many community-led victories, including 9 environmental bills that were passed in the 2020 Colorado legislative session.
And the timing of our report development also allowed us to use our initial findings to support one of these such bills that passed the Colorado State Legislature, HB 22-1244, Public Protections from Toxic Air Contaminants. Using data from our report findings, I prepared an oral testimony and delivered it at the House Committee hearing. My testimony focused on how communities like North Denver experience a disproportionate burden of air toxics pollution and therefore need political action to prevent further perpetuation of health inequities and harm. After an 8-hour hearing, this bill passed the committee and eventually the full House and Senate and was signed by the governor in May 2022. Though my testimony was surely not the deciding factor, it was an eye-opening lesson on how we can use our role as academics and public health professionals to add evidence and credibility in support of real-world efforts that will benefit communities. If you've never had the chance or experience of testifying on a bill, I highly recommend it, as the experience is worth the inevitable anxiety.
Thank you, Carla. And following the signing of HB 22-1244 by Governor Polis, who we know is a champion of environmental justice, we were excited to share this story with a larger audience. And in late 2022, I compiled our findings into an ArcGIS StoryMap, a visual walkthrough per se that wielded the power of geographic information systems, or GIS, and publicly available data. I will briefly give our audience a tour of this website and urge you to share the StoryMap with others. So maps are a very powerful tool and have been used to disenfranchise marginalized communities. But when integrated with community-engaged values, can bring a deeper understanding of inequality, empower communities, and advance racial equity, social justice, and sustainable inclusive development. I've used data sources like the City and County of Denver and Commerce City's open source GIS data website, the EPA's EnviroFacts and ECHO database, and other sources, giving the public an opportunity to engage with the North Denver report in an interactive and transformative way. This was especially relevant when Suncor was headlining in the news. One especially exciting feature of our story map was the map series, which I will point out below. This map series pinpoints 5 major facilities from our report and the number of quarters of non-compliance with EPA, CWA, CAA, and RCRA standards. All these facilities are within a few short miles of each other with residents scattered in between, which highlights the burden of industry on North Denver communities. And unfortunately, the map series isn't quite showing or zooming into the location of these facilities automatically, but you can see again that all these facilities are located within just a few short miles of each other. Finally, this digital journey ends with a few notes about data justice, how to get involved, and build a healthier relationship with North Denver. And it also links our reports, community partners, social media accounts, and other resources below. Data justice plays a key role in furthering community-led action to achieve health equity. While better data and more comprehensive studies are necessary to better document and understand the cumulative impacts North Denver residents face, the existing data is sufficient to show that environmental health risks exist and must be addressed. We hope that this presentation has urged you to join the fight of North Denver and many other communities at the forefront of EJ issues to take action to break down silos in data, research, government, and communities as we reimagine a future that is equitable for all people. Thank you for your time.
And we just want to give a quick acknowledgement to our lab members who help with this project, one of which is in attendance, Stephanie Pease. Of course, our community partners, GreenLatinos, Ian Tafoya and Juan Madrid, and our other collaborators at the Northeastern University, as well as the North Denver and Commerce City community members and organizers who have been at the forefront of this fight. Thank you.
Thank you, Carla and Ruth. That was an amazing presentation, and I hope that I see you on the federal floor testifying, because this couldn't be more timely. I will now open up the session for about 3 minutes of Q&A. If attendees have any questions, feel free to drop them in the chat, raise a hand so that we can get them addressed for you. I see a lot of praise. If attendees do not have a question, I have a couple questions. First is just making sure that they didn't have a question. Can you talk a little bit more about how your partnership with GreenLatinos developed and how the priorities of your work shifted over time?
Yeah, definitely. I'll start with that. So our lab's collaboration with GreenLatinos started about 3 years ago now, just with a personal relationship between Katie Dickinson and Ian Tafoya, who's the state director of GreenLatinos. They had met through both participating in environmental justice work and committees, et cetera, throughout the state. And so, yeah, like we mentioned in the presentation, the project initially started with this idea that our collaborators in Boston had conceptualized of this reciprocity quiz and kind of getting the environmental justice information to communities who may not be as affected by the impacts of the environmental harms and maybe not aware of the relationship that they have with the communities where these harms are concentrated. And so that had been our initial goal, but as we began to gather all of this data and information that we were going to use to inform the quiz, it became really clear, both from Ian's priorities as well as community members we were doing focus groups with, that, you know, we needed to get this information to the North Denver community members first and present that to them in a really accessible way. And now we are also moving forward with that initial goal of our research to communicate this to a larger audience. But it was, like I said, a really important lesson about just staying in tune with what the priority of the community you're working with is and how that may evolve over time. So I see a question in the chat about the ECHO database. Would you like to take a stab at that one, Ruth?
So Carla, just to clarify, this is Mike Barbie's question, or are we looking at another?
No, so it's something in the chat. He just said, can you explain a little more about ECHO database and how you are working in it?
Of course, thank you. So the ECHO database is the EPA's official database where they record any facilities that might be in violation of any of our environmental protection laws. So the database can be a little bit tricky to navigate, as Carla and I and the rest of our team quickly found out. But it was a very helpful tool as well, because it wasn't simply a database full of CSV files or anything like that, there were also charts available and interactive maps that allowed you to make searches of facilities that might be in violation of a particular environmental law in a certain neighborhood, zip code, city, or even state. And again, it was a little bit tricky to navigate, but as we went through our report and our StoryMap following, it became clear that it's a very strong tool that has not only been used by our lab, but also other environmental health researchers. And I guess this, in a way, ties into Mike's question in the Q&A. What are the common types of data misuse that leads to disenfranchisement? And so we report in our findings that reliable and publicly available data, especially on the full range of businesses that exist in our study zip code, which is 80216, and their environmental impacts are lacking, mainly because the EPA does rely on inspections, and these inspections recur pretty infrequently. And also the industries that are responsible to give the EPA warning if they have, violated any policies, these industries are responsible for self-reporting. And so that can actually lead to major concerns about data quality and completeness.
Awesome. Thank you so much, Carla and Ruth, for that amazing presentation and for your comments. For time, I'm going to move us to our second presentation, which is titled Making the Unseen Seen, Youth-Driven Community Planning, presented by Maya Chastain, Giselle Chavarria, Mari Montez, with support from Janice Stiglich. Go ahead.
Hello and hola al grupo. We are a la raíz and our presentation is about making the unseen seen and our youth-driven planning. My name is Marisol and I go by she, her pronouns, and I go to Fairview High School.
My name is Giselle. I also use she, her pronouns, and I'm a student at Dawson and I'm a junior.
Hi, I'm Maya. I use she, they pronouns, and I'm a junior at Fairview High School.
And hello, I'm Janice. I use they, a pronoun, and I am their supervisor.
Okay, so our project is a la raíz, or to the root in English. We are part of a community substance abuse prevention at Boulder County Public Health. A la raíz is funded by SAMHSA, and our ultimate goal is to seek the root causes of substance use and mental health in Latina and LGBTQ communities. We, as youth research assistants, were hired last June to investigate the gaps in the first cycle's youth data by creating a community action committee that is called Youth Advocating for Youth, or also known as YAY. And we are working on our own projects, and we will be discussing the YAY feedback sessions in this presentation.
There we go. So the YAY feedback sessions borrowed a framework created by the Movement of Working Children and Adolescents, Children of Christian Laborers, or MANDOC. They used it to show how their social movement was just as important in the fight for comprehensive sexual and reproductive education in Peru as the various multinational NGOs who were funding them. So in the spirit of forming coalitions with different groups that we work with throughout our county, we decided to borrow and modify their process to fit the needs of finding the root causes of substance use and mental health struggles in our Latina and/or LGBTQ+ youth in Boulder County. I don't know what is happening, y'all, but let's do this again. There we go.
How we changed it up. Our first thing was to figure out how to add a data gathering component to an already great community building process. So, like the picture shows, a la raíz and yak are made equal by the mountains, and we are like ducks going from one mountain's pond to another, bringing our collective knowledge together into one river of knowledge. We added levels of care to represent information we wanted to find out from other youths. So, to honor Colorado wildlife, youth who participated were asked to talk about what would help them reduce substance use and better their mental health in different stations. We asked youth to write on animals that represent the following levels of care: as individuals, as friends, as a part of a family, born or chosen to, sorry, as a student or worker, and as part of a neighborhood. We also added a station to a giant post-it that was like, draw out what you do for self-care. We also added another one where youth could speak back to the power, where we asked, what would you like people empowered to know about you and your friends' experiences?
So Youth Advocating for Youth, or YAY, is formed by 3 programs belonging to community health in Boulder County Public Health: A La Raíz, GLOW, and YAC. Generations Leaders Organizing, or GLOW, is a leadership cohort of bicultural Latinx youth who gain skills throughout their lessons and projects, work to foster peer-to-peer education, and collaborate closely with community partners. GLOW Youth are part of the Generations program. Youth Advocating for Change, or YAC, is a group of sexual and gender diverse youth who partner with other LGBTQ+ youth to change systemic oppressions in our society. YAC is part of the Open and Affirming Sexual Orientation and Gender Identity, or OASIS program.
So the YAY responses, which we mentioned before, will form recommendations that will benefit Latine, and or LGBTQ+ youth. These recommendations will be handed to the Boulder County Behavioral Health Roadmap, Boulder County Public Health Improvement Plan, as well as the Community Health Assessment to inform policy concerning Latine and or LGBTQ+ youth. So the roadmap will serve as a shared vision and a 5 to 10-year plan to make sure mental health and behavioral health is supported in Boulder County. For our part, we are providing a data that is often for invisibilized youth in Latine and LGBTQ+ communities.
So for these sessions, 3 things are key for them to function smoothly: fidget toys, a Spotify playlist, and food. Everything else is used from community health working together to assign use, hand out demographic surveys, facilitate sessions, tape up animals to the mountain scene, answer questions, and refer to adult staff when there is any confusion. We compensate youth with $30 gift cards after their participation, and our hope is to send out an analysis of what we have found when we finish up later this month. This process has worked so well that we wanted to share it with all of you and let you explore methods of data collection with youth and adults alike that are a little less formal, but just as effective to reach those root causes that we seek.
Gracias.
Thank you.
Thank you. Gracias and merci.
Thank you so much. That was an amazing presentation, and I really appreciate y'all taking the time to be here. We do have time for Q&A. I'm going to open it up to the attendees. If you want to put a question in the chat or the Q&A function, I am monitoring both. But while we wait for that, I will bring one to you all. First and foremost, what are y'all working on next?
I can start. Right now, I'm working on looking into self-esteem as a protective factor against substance abuse in the LGBTQ+ community. So I'm running focus groups and individual interviews to get at that data.
I'm also doing my own individual project, but I'm focusing more on the how does crisis response impact the lives of Latina and LGBTQ+ youths. My proposal has been recently accepted, so I'm getting through the process to be able to start meetings and focus groups with youth all over Boulder County.
Awesome. And I want to let you know that the chat is blowing up with praise. So great job. And it's also blowing up with questions. We had a question, youth are compensated in this program. Did you say that they receive $30 gift cards?
Yes, they do receive $30 gift cards after we're done doing the presentations and everything.
Awesome. Other questions are, do you have any initial conclusions to share from your original sessions?
Any of you want to share anything, or do you want me to take this?
I think I can at least like answer a little bit about it. So, and I'm not sure how many we've done in the past, but I think we've done at least like probably 10. We've done a lot of meetings with the youth in Longmont, in Lafayette, in Boulder, all over. And we have actually noticed that there is a lot that they're saying. And it's funny how it's just great to see how much they want to get involved. We are trying our best to help them feel seen in a society that doesn't allow that, and being able to help them and just like represent slash helping their image be there to make them feel happy and feel comfortable is really good.
Any other comments on that question? Thank you, Giselle. I completely agree. Of course, I am not a part of that generation, but I resonate with some of those statements when you said bringing the voice here. Another question is, did anything from your results surprise you or take you in a different direction when you were leading these?
Yes, for me, a lot of the things that a lot of people were saying were really surprising. Some were really common, but there was a few answers that had me thinking a lot about what we're working on. And it's just really interesting seeing how a lot of people have different opinions on things and just everything. It's honestly really nice having people tell us what they're thinking and what's on their mind. It's really nice.
And we'll also add that we have seen consistently in every group we've worked with that youth want access to free mental health services, like access in schools, access for where they don't have to maybe like have the consent of an adult to speak to somebody. Just continue everywhere we go in mental health services access.
Thank you. Any other comments on that question? Awesome. There is a Fairview High School alum in the chat. So you are representing your high school well. And then another question is, what has given you the indication that this process has been successful?
For me, it's just honestly our participants' willingness to respond and voice their concerns when it comes to substance abuse in their community and mental health resources, because, you know, a lot of people do not have an opportunity to share their voice when it comes to these topics. So.
All right, and then we have one more. It says, thank you. When you say services, do you mean medication, therapy, support groups? What mental health services are they seeking for free?
So it really does range, but therapy and a therapist and a counselor, or more access to their interventionist, because at times their interventionist is also overwhelmed with students. So therapy has been like the number one, like a therapist.
Amazing. And then last question was, as a Boulder County resident, are there ways community members can get involved?
Okay, so I'll take this. Honestly, meet youth where they're at. Don't try to force them to do something that maybe they're not ready for. If they're giving you an attitude or abstinence, it's not because they want to, it's because they literally cannot right now. And so meet them where they're at, find creative ways to talk to them, and of course, you know, try to get involved as much as you can with different organizations like Allow My Children, Youth and Families, like Teen Zinc in Netherlands, like Yoab in Boulder. I'm missing so many, so I'm gonna stop there, but yeah, get involved.
Amazing. Thank you all so much. I hope that you look in the chat when you get a chance to read all of the praise for this amazing presentation. I'm going to move to our next one and hand it over to Angela yet again so that we can wrap up with our last presentation.
Thank you, Lindsay. So our third presentation is entitled Searching for Home, Analyzing Access to Intimate Partner Violence Shelters in Colorado. And this will be presented by Alyssa Dalen, whose pronouns are they, them. Take it away, Alyssa.
Thanks, Angela. And thanks everyone for being here. It is a hard act to follow with those two amazing presentations that we have listened to already today, but I will do my best. As Angela mentioned, my presentation today is called Searching for a Home Away from Home, Visualizing Access to Intimate Partner Violence Shelters in Colorado. So right away here, I want to take a second and have you all check in with yourself and just give a very brief content warning for this presentation. There won't be a lot of direct reference to super explicit terms or definitions, but this presentation does contain reference to a few terms and definitions surrounding sexual violence that could be sensitive or triggering. So I just want to encourage you all to check in with yourself throughout the presentation and feel free to take breaks or exit the call as needed. Take care of yourself. So just some background here. First, I just wanted to acknowledge that this presentation and this project as a whole was born from a course that I was able to take at the Colorado School of Public Health. And this course was a great experience. It was an ArcGIS methods course that allowed us to conduct final projects on topic areas that we were interested in. So I just wanted to acknowledge and shout out that course for being a great experience. And then also to start us off, I wanted to provide some background so we all have the same lens here going into the presentation regarding intimate partner violence, or IPV. So you may hear some other terms referred to around this topic, including domestic violence or relationship violence. And these terms are referring to any physical, psychological, or emotional abuse or aggression that occurs in the context of a romantic or intimate relationship. And one of the largest things that we know about IPV is how widespread this is. Unfortunately, IPV affects almost 1 in every 4 women and 1 in every 9 men throughout their lifetime. IPV experiences can lead to a multitude of negative impacts across someone's lifespan in very many different aspects, such as mental health, well-being, physical health, daily functioning. And interestingly enough, and unfortunately enough, IPV experiences are the leading cause of homelessness among women and dependent children in the United States. So this is a very prevalent issue and a large public health concern facing our communities. So touching briefly on some factors regarding resources for intimate partner violence survivors or victims, accessing IPV-specific resources has been shown to reduce a lot of those negative outcomes that I spoke about previously. It's also essential for protecting survivors from any further harm within the relationship that they are experiencing. However, resources are often unavailable. So the National Network to End Domestic Violence every year completes a 1-day study looking at resource access and requests being made throughout the United States. So on 1 day in September of 2022, there were almost 13,000 requests for services from IPV survivors that went unmet in the United States. And almost 6,000 of these requests were for specifically emergency housing or other residential resources. And then to look into the lens of Colorado for a second, on this day, there were approximately 120 unmet requests for emergency housing in Colorado. So it's very clear that access is an issue regarding IPV resources. People are reaching out for resources and often are unable to find them. And then pivoting a bit to some of the analytical techniques used for this project, I wanted to just touch on and define what spatial analysis is. So Esri, which is a company that produced the ArcGIS mapping software program that I utilized for this project, defines spatial analyses as the process of examining locations, attributes, and relationships of features in spatial data through methods like overlay and other techniques in order to address a specific question or gain useful knowledge. And spatial analyses are important tools that can help us inform resource allocation and also systems and policy change. And in the last couple of decades, these methods and techniques have become increasingly popular. However, there are very limited examples existing regarding their use within the field of intimate partner violence research, which is a gap that I hope to address. And I wanted to highlight the couple of examples that I was able to find in the literature of spatial analysis used within IPV research. So in 2010, a study was completed that compared service locations and aggregate crime data within Connecticut to identify overburdened and underserved areas. And just last year in 2022, a researcher analyzed some data from Los Angeles County to identify census tracts experiencing service gaps and compare that with some aggregate sociodemographic data. So this is some of the background that builds the foundation for this project. So what is this project? What did I complete? So I had a couple of aims during this project. The first was to collate a list of intimate partner violence emergency shelter locations, and I put approximate, and I'll explain that a bit more in a second, within the state of Colorado. My second aim for this project was to conduct a spatial analysis visualizing geographic gaps in access to IPV shelters and to compare these results with some sociodemographic census data. So looking into how I completed this project, the first step was to determine the approximate locations of intimate partner violence shelters. So I was able to find 3 different resources that had available lists or maps that you could search to find IPV shelters near you. So these are public-facing databases and websites that you can imagine that survivors or victims of IPV would be able to navigate. First was Violence Free Colorado's resource list. The second was from the Colorado Department of Human Services. And then the final database was through the Colorado Coalition Against Sexual Assault, or CCASA, which linked out to the You Have the Right campaign. So next, completing the actual service area analysis, I just wanted to highlight a few steps here. So the first step that I completed was to create this map visualizing regions around IPV shelter locations that were accessible by 10 minutes, 20 minutes, and 30 minutes of drive time. And then I was able to map the mean population centroid locations for each census tract. So briefly, the mean population centroid is a location visualizing or a location of where a census tract's population is centered. And after those things, I was able to assign a value based on whether that mean population centroid location, so this indicator of the location of where the majority of the population of a centroid lives, was included within 10, 20, or 30-minute drive times from IPV shelter locations. So looking at some of these IPV shelter locations, I'm going to zoom in on this map here. I was able to geocode and have the ArcGIS program map these approximate locations of IPV shelters. However, if anyone is familiar with IPV resources or shelters, you'll know that oftentimes shelter locations are protected or kept anonymous to protect the safety of IPV survivors. And that was not something that I was hoping to unprotect during the course of this project. So when physical addresses of the actual shelters were unavailable or protected, I used PO box locations as a proxy location. Many of the shelters have separate PO boxes for mailing. So I'm just kind of going around on this map to show some of these pinned locations of domestic violence shelters. But if you look at the map as a whole, you can see that these locations definitely do not cover, just visually on a first glance, do not cover the entire state. And then to get more into this story here, this map is showing, visualizing the service areas around each IPV shelter location. So I'll just open up my map legend here to show you that these service area drive times in minutes are indicated by the pink and the orange colors on the map. So the darkest colors of pink show areas within 10 minutes driving time from IPV shelters, and orange is 20 minutes, and then the lighter pink is 30 minutes. So you can see a bit more of what this looks like on this map. Again, these are not covering the entire state by any means, but I wanted to get a better understanding of, are these services available to the majority of people within each census tract? And overwhelmingly, the answer was no. So this third map here shows the results of the analysis around whether that mean population centroid of a census tract was within the service area drive time to IPV shelter locations. And on this map, the lightest color yellow means that these census tracts are outside of the service area. So to save you all from counting, I was able to have the program give a count. This is 180 census tracts that are outside, have a census population centroid outside of that 30-minute service area from an IPV shelter location. So that's fairly substantial and fairly telling about widespread gaps in access to these IPV shelters. And just briefly, I'll touch on the other portion of this analysis that I completed was comparing some census tract or census level demographic variables, which I did find some significant associations, but I didn't want to highlight these too much during this presentation because some further analysis of the results suggested that there were some inconsistencies in the trends across the entire analysis region. So it's important when there's not consistent trends across the entire state. I didn't want to make any claims that aren't accurate or say anything that isn't supported by the statistical evidence that I was able to find. But this does indicate that some future testing, some future analyses might be helpful in this area. So in conclusion, the key takeaways that I'd like for you to come away from this presentation with is just the sheer fact that about 180 Colorado census tract population centroids are not located within a 30-minute drive time from an IPV shelter facility. The other takeaway that I'd like to share with you is the potential that these types of analysis techniques have to inform resource allocation as well as policy decisions within the field of IPV research. This is an area that has a lack of data and a lack of data that's easily analyzed in ways to indicate resource allocation and policy decision making. So I really feel that this technique has a lot of potential to address these concerns. And to touch on some limitations with this project, I only considered the locations of IPV shelters. However, there do exist many other types of emergency residential services, some of which there's even movement to utilize more often than IPV shelters. And some of these include things like hotel vouchers, temporary housing assistance, and other types of housing programming. However, our current services do still rely and use IPV shelters. So I still feel that this analysis is very relevant for current practices. As well, I already touched on this a bit, but further analysis wasn't completed on the sociodemographic data, which could be helpful in the future just to characterize trends and determine which communities might be facing the greatest risk of negative IPV-related outcomes due to a lack of access. As well, the exact locations of IPV shelters were protected or kept anonymous, which could have impacted the accuracy of this analysis. And then I have some further recommendations listed on the screen, but I'd really like to open it up for some discussion or some questions if anyone has any questions.
Alyssa, thank you. I was wondering, do you feel comfortable typing your answers into the Q&A box for these questions that we're receiving?
Sure, I can do that.
Awesome, thank you. With that being said, I want to thank all of our presenters, and I was going to hand it over to Angela to wrap us up and make sure that Alyssa has the space to answer questions in the chat box as well.
Thank you, Lindsay. Thank you all for attending this session and engaging in the Q&A. A few short announcements before you head out. All of the slides and any additional handouts from the speakers will be provided in the SCED. So video recordings will be up there eventually. And currently all the slides are there. You will receive a conference evaluation form as well via email after the conference is over. Please fill it out. It helps us to improve the conference in future years. There will be a raffle for anyone who completes the survey within 2 weeks, and you could win one of two $50 gift cards. So just an incentive for you to fill out that evaluation. But we'd love to hear how you thought everything went and how we can do better. Thank you for attending, and we'll see you on the other talks.
Oh my gosh, thank you all so much. These presentations were so wonderful today. I think this so far is my favorite session of the conference.
Rachel, yes to your text.
Thanks for having us.
Alyssa, we are leaving the webinar open just so that you can finish typing the answers to your questions. So you don't feel rushed to hop off. That was my bad, so I apologize.
No worries.
Thanks
Thanks
you to our attendees. Who did I just cut off?
Nope, I was just saying thanks to the organizers. So.
Oh, yeah, thank you. Thank you, Stephanie, for being here. We appreciate you. Our other sponsors, if they're still here, thank you as well. Alyssa, you also received a lot of praise in the chat as well.
Thanks, Lindsay.
Perfect. Any other questions or comments before we let y'all move on to the next session? Nope. Awesome. Well, y'all did great. Thanks to our sponsors. Thanks to our speakers. Thanks to our straggling attendees, I hope you all had a great day, and I hope to see you at the next session. Have a good day.